Today, the numbers are headed in the right direction. COVID-19 cases are decreasing here in the Central Texas area. But this is after we saw a spike in cases around the start of school, including more pediatric patients. Now, even if kids who contracted COVID are no longer sick, parents do need to be aware of long-haul symptoms. Joining us now is Dr. James Versalovic. He's the pathologist in chief at Texas Children's Hospital and the director of Texas Children's Microbiome Center. Dr. Versalovic, thank you so much for joining us.
Well, good morning. Texas Children's is proud to serve Houston and Austin.
We want to start with just how common this is. How many long-haul COVID cases are you seeing?
Well, we don't have exact numbers at the moment. What I can emphasize at the beginning is we are certainly continuing to see Delta cases in children and adolescents beyond initial infection. And as you said, the numbers are improving in Texas, and that's the good news. But we still need to be very cautious as Delta is certainly prevalent still in the community, positivity between 5 and 10%. We have MIS-C cases, so acute infection, MIS-C, and long COVID are the three aspects of COVID that we need to be concerned about, and certainly that's the case with children and adolescents. We are seeing MIS-C cases that can be serious and life-threatening in children now due to Delta 3 to 6 weeks after infection, and these children require hospitalization, 2/3 require critical care. Long COVID may last for weeks or months. We have children presenting to our long COVID clinic at Texas Children's where they get expert subspecialty care because they may have cardiac or heart arrhythmias, cardiac conditions that linger, pulmonary residual disease in the lungs, neurologic symptoms, and behavioral manifestations as well. So long COVID is very real, affecting up to roughly 10% or so of children with COVID.
So when we're talking about the symptoms that go with long-haul COVID in kids, is that any different than adults, or what should parents be looking for?
Well, there are various features of long-haul COVID, or long COVID as we call it. It is difficult to say exactly. We know certainly children may experience ongoing fatigue, and it may be some of this is certainly similar in adults, but there are certainly distinguishing features in children. I think clearly we've been emphasizing the cardiac and pulmonary as well as the neurologic and behavioral components. I will say with respect to adults, we know about brain fog and having certainly an effect on the central nervous system in the brain and not being able to think as clearly weeks or months after infection. That certainly impacts children as well. We're seeing this with adolescents too. We do know that children, though, certainly have cardiac conditions that include arrhythmias, so that athletes, children and adolescents who are playing sports may not have the same endurance, may not be able to participate in sports, and may need care from a pediatric cardiologist. We also have children who may have a decrease in their physical activity and performance and fatigue due to residual lung disease as well. And then finally, the behavioral component. We are concerned about long COVID as it affects children's moods and behaviors. Anxiety and depression have been documented as part of long haul or long COVID. So there may be this other behavioral component that may require also consultation with a child psychologist or psychiatrist. So it's varied, and parents just need to be aware of these different features of long COVID, and a child may have one or two prominent features of long COVID and lack the others. So it will present differently in different children, roughly 10%. So the good news is 80 to 90% of children may have no or very few lingering symptoms from COVID once they're over the acute infection. And so we still have to be concerned about MIS-C due to Delta and long COVID now due to Delta. But the 10% or so, if you do the numbers, more than 5 million children diagnosed in this country with COVID-19, that adds up to 500,000 or more children that may be suffering the lingering effects of long haul or long COVID for weeks or months, and that certainly may impede their quality of life.
Well, that's really helpful information for parents. That is all the time we have, but Dr. James Versalovic, thank you so much for joining us. He's the pathologist chief at Texas Children's Hospital and the director of the Texas Children's Microbiome Center. Thanks again for your time.